Before approaching any victim of any injury, survey the scene.
If time allows and the equipment is available, make sure to use personal protective equipment because you are the first priority. In the last clip, I slipped on a loose object on the floor and broke my arm. These are the steps that I took to heal my broken arm. First, I stopped the bleeding by applying firm pressure to the wound area with a clean cloth until the bleeding stopped. Then, I reduced the swelling by applying ice. Then, I immobilized my arm. And finally, I saw a healthcare provider immediately. For follow-up, I went back to the healthcare provider to do x-rays and apply a cast or a splint. Here's how you put on the sling. First, gently pull the sling over your arm and elbow. Second, reach around your neck and grab the strap that is attached to the sling behind your elbow. And third, fasten the strap. Always make sure that your arm is at a right angle inside the sling.
See, our word is slowly dying. I'm not wasting no more time. Don't think I could believe.
You think it's boiling yet?
So I got a 3rd-degree burn. Here are the steps that I took to treat it. Early cleaning and debriding, which is removing dead skin and tissue from the burn area. Then you want to get IV fluids containing electrolytes. If it gets infected, you want to take IV or oral antibiotics, antibiotic ointments or creams, and you want to keep yourself in a warm, humid environment. 4th-degree burn is a burn that not only damages the skin, underlying tissue, and nerve endings, but may also reach all the way to the fat, muscle, or even to the bone in some cases. There is no healing in the area with this type of burn. In most cases, amputation is needed because the function is at a complete loss.
See, our word is slowly dying. I'm not wasting no more time. Don't think I could believe.
Sammy, come look, it lost a tooth.
Aw, so cute.
It hit my nose!
For an animal bite, make sure you wash the area with soap and water. Apply pressure with sterile gauze or a clean washcloth. Cover area and offer ibuprofen for pain. You should definitely check your medical records for a tetanus shot. It's recommended every 10 years, but it doesn't hurt to get it more often. Go to the doctor if there's embedded teeth or other foreign objects in the wound. Possible underlying nerve and blood vessel damage, risk of tetanus immunization is not up to date, or consider the risk of rabies depending on the end.
You and see the children are starving and their houses were destroyed. Don't think they could.
For severe bleeding, don't remove large or deeply embedded objects. Don't attempt to clean. Place sterile bandage or clean cloth on top of the open wound. Press firmly and maintain pressure until it stops bleeding. Help the injured person lie down and reassure that she's okay. Are you okay? If bleeding seeps through the gauze, add another bandage on top of it. Apply a tourniquet. When emergency help arrives, explain how long the tourniquet has been in place. Immobilize the injured body part as much as possible. Remember, call 911 for severe bleeding you can't control.
Ow, ow. First thing to do for a spinal injury is lay the person down. Second is to get help, call 911. Keep person still. Place heavy towels around both sides of the neck or hold neck and head to prevent movement. Kneel or lie behind and rest elbows on your knees or ground and place hands on head without covering ears. Modify CPR technique. If person shows no signs of circulation, breathing, coughing, or movement, begin CPR, but do not tilt head back to prevent to open airway. Use fingers to gently grasp the jaw and lift forward. If the person has no pulse, begin chest compressions. Keep helmet on. If the person has a helmet, keep the helmet on and do not remove it. Don't roll low. If someone has to be rolled over because of safety issues, make sure you have 2 people to roll and make one person hold head still.
And see the children are starving and their houses were destroyed. Don't think they could forgive you.
Shock may result from trauma, heat stroke, blood loss, an allergic reaction, severe infection,
poisoning, severe burns, or other causes. When a person is in shock, his or her organs aren't getting enough blood or oxygen. If untreated, this can lead to permanent organ damage or even death. When a person goes into shock, first call 911. Then lay the person down if possible. Elevate the person's feet about 12 inches unless their head, neck, or back is injured or suspected bones, hip bones, or leg bones are broken. Do not raise the person's head. Turn the person on the side if he or she is vomiting or bleeding from the mouth. Then begin CPR if necessary. If the person is not breathing or breathing dangerously weak, for a child, start CPR. For an adult, start adult CPR. Continue CPR until help arrives or the person wakes. Next, treat obvious injuries. Then, keep the person warm and comfortable. Loosen restrictive clothing. Cover the person with a coat or a blanket. Reassure the person. Do not give them anything to eat or drink. Then, follow up. At the hospital, the person will be given oxygen and fluids. Blood tests, urine tests, and other tests will be run. Other treatments will depend on the cause of the shock.
Our hair will be great. Don't